Thank you so much, everyone, for joining this call. Good afternoon, good evening, and good morning to everyone joining us from across the world. On the behalf of Unite Global and the Fast Track the Cure, I warmly welcome you today to this global youth-led webinar, empowering communities through TB literacy, strengthening awareness, access, and adherence. And thank you to all the distinguished speakers, National TV program representatives, community leaders, youth advocates, and our partners who have been joined this call and continue to stand with us in this fight to end TB. As we all walk into 2026, we know that 2025 was a challenging year. Shifting funds, changing priorities, and uncertainty across the development sector deeply impacted TB and community-led work. But today, on the 27th day of 2026, we are together with a renewed purpose and realigned our effort to rebuild momentum and jointly move forward in the fight to end TB. TB remains treatable, preventable, and curable. Yet, gap in treatment literacy, awareness, and access and adherence continues to affect millions. Strengthening community understanding to TB treatment is not optional. It is essential for better outcome, dignity, and people-centered care. As a young person myself, I feel extremely proud to welcome you all, our speakers and participants today, individual and institutions who have been remained committed to ending TB in every situation, even during the most difficult times. Today in this discussion, you will see the discussion from and the presentation from National TB Program perspective, community experiences, and youth leadership. And with this, I want to welcome our opening speaker, amazing personality, a Romanian physician, global public health leader, and who have served as a executive director of the Stop T Partnership since 2011. A lung disease specialist, she began her medical career in Romania and joined the World Health Organization in 2000, working across national, regional, and global level in TB response. Renowned for her public speaking and people-centered and innovative leadership, Dr. Ditu has transformed the Stop T partnership into a dynamic and influential platform advocating for universal health coverage and world free of TB. I always remember her one line, her one belief is that the day you give up is the day you die. She remains unwavering in her mission to end TB in her lifetime. I just want to bring her to the spotlight and hand over this floor to her. Thank you.
Thank you so much, and thank you very much, Aman, for this very emotional for me presentation. Yes, several years, many years since I joined the Stop TB partnership, and we did so far an amazing travel together, not an easy one. Several of you here, thank God, were in the kindergarten probably when Stop TB, when I took over the Stop TB, I imagine, or at least in the primary school. And, you know, we come from a very long way from an organization that intentionally was kept in dark and unknown. So I'm very proud of where we are right now. But more proud than where we are right now, I am to be here with you and to see these great achievements of Unite. Aman, thank you very much for all the hard work that you and the other colleagues in Global Unite are doing to make these things happen. And I know it's not easy, and I know it's discouraging, and I know it's difficult, and I know it's like in the times that you should have all the wings to fly, you all young generation, there is this entire agitation, there is this entire uncertainty, there is this entire worry that is around the world. And, you know, it's very difficult. I'm thinking of, you know, and that's why I say I admire you so much. I have a son which is probably close to your age, and I look at the way that he pushed forward, but he has so many doubts, and I imagine that probably doubts and worries are in your heads and hearts as well. But as you said, we cannot afford to give up, not just in TB, but in general. I think the world is constructed on love, and I think the world is constructed on us caring for each other. And I think that we should not allow the ugly people that try to destroy, that try to break the links between us, that try to put doubts and horrible things in our minds and hearts and thoughts, we should not allow them to win. You know, always the good and the love and the empathy and the support for each other will win, whatever the drama and the problems we go through. So that's why we will not give up. And if I say that, I know that you will say that 100 times stronger. I was looking at my screen shows me and Norbert and some of you from the Unite. And I was laughing that me and Norbert, we don't have this beautiful background that you have. And I was thinking probably it's a sign, because even if you sent it to me, I don't know how to do this stuff, which is such a clear indication, at least for me, of the fact that you are the young generation operating in a very different way and doing things so much quicker and better. So I want to say three things after this. First of all, you should go ahead as the Global Unite and as the Unite in bringing together people with TB from different backgrounds, but especially to drive the movement. You, as those young, you should slowly move and take it over from all of us and be the ones challenging the status quo, challenging the situation, challenging the solutions. But also, you see, it's easy to challenge. And this is my continuous problem with the people that are the ones less beautiful, let's say. People, it's very easy to criticize. It's very easy to throw mud. It's very easy to throw bad things, but you should come with solutions. So don't feel shy to tell your solutions. Don't feel shy to bring it up and say, we don't like how this happens. We suggest this is how things should happen, and change that. So the first thing is that I have full faith, belief, and now hope, seeing, you know, we are more than 100 here. Well done, being together and pushing forward this agenda. Secondly, in TB, you know, we are fighting, some of us, me and Norbert here, and probably others. But again, is that I see on the screen, we are working for our entire life in TB, right? Or our entire professional career. And it's, I speak for myself, it probably breaks our heart for the fact that we are still seeing so many people undiagnosed, untreated, people that don't have access to basic things for the TB response, and people that die, including children, from a communicable disease. So we made huge progress from where we started. We saved millions of lives, literally, and we should be proud of that. But we need to continue and go forward. And the way that you are putting this forward as a, you know, about looking at treatment literacy and looking at the youth being at the front line of awareness and access and adherence, it's extremely important topic. So we will have to do whatever to support you in this endeavor. And you should count on Stop TB Partnership for all this pressure. And as you know very well, with you know, our challenge facility grantees using the UNITE funding, as well as the French continue forward, especially looking, but especially UNITE, looking at the drug-resistant TB aspects and working together in improving the treatment literacy and so on. This was my second point, that it is a place for the youth. You are the ones that should challenge the access. You should challenge why people don't know more about TB. Why is the language not allowing them to say more about TB, and so on and so on. And then the last point, I want to say this. You see, we allowed for too many years to that depend on donors only, and particularly in TB only on a major donor, right? It was not only because we allowed, it's because we like it or not, we don't like it, but that's a reality. Many donors are not that keen to fund TB. And as you know, a lot of funding goes in different way. And, you know, Global Fund is a big funder, but unfortunately, TB is not the top of the Global Fund funding agenda. Maybe they think about TB generously, but on the funding is not visible, they're thinking about TB, okay? So everything that you do, I urge you, and take it as a saying from an old woman, think of whatever you do to make it sustainable, and think of what is going to happen if this donor or this work disappears. And it's a very horrible feeling. You feel this thing here, like, but it has to be a discussion about it. And at country level, to make it sustainable, especially the youth movement, is really trying, as much as it's difficult and as much as challenging, trying to link with the TB program and trying to link and ensure the support and the engagement with the government. It will be very important. It's not easy. I am happy to see Norbert here because in South Africa is different, and Norbert and the colleagues have a great interaction with survivors and communities. There are many countries like that in which the public sector understood so much the importance of the communities, survivors, and now, for example, the youth or vulnerable populations, in making sure that the response is the right one. Is not always or everywhere like that, but that should not how to say, discourage anyone to really make sure that the governments, that the ministers, that the NTPs understand that you, let's refer to you as youth, are there to help. And without your help, they will not be able to reach in the right communities. They will not be able to reach all the people that you can connect with. They will not be able to provide the services in the same way as the communities and civil societies can do in their own communities. So that's understood. And then from the communities side or from the youth side, it's good to understand that without the engagement of the government and the NTP, things might not be sustainable. And you saw so many things that were funded by donors disappearing overnight when the donor funding ended. So I think impactful you already are. You cannot say that you are not impactful, Aman, and all of you here, without having, you have 114 people online. This is huge and amazing. So I think you just need scalable. So we need to have the Global Unite reaching 1,000 people by the end of the year. And, whatever we do. And then sustainable, I refer to it a little bit. I'm following the instructions from Aman. Whatever he told me, I'm doing, and the delivering said touch on this point. Anyway, I'm smiling. I will finish here. I will stay online. I'm looking forward to this. And I'm really, really, really honored to be here with you. And I'm looking at you as the next generation leaders to take on these bloody diseases, including TB, and to not allow it to kill people anymore. Thank you.
Thank you so much, Luchika, for that powerful opening remark. And this is really well understood that sustainable and country level engagement, coordination, and working with NTPs is very much important for scalable and also for a sustainable work. And we are not going to stop. Young people are the future, and we are going to go in more forces. And I remember while we were inaugurating and launching this network, and you said us something that you have a full power with full speed, you go ahead. And we are in this full speed, irrespective of any obstacle that we see, we will overcome and we will end TB together. Thank you so much, Luchika, for this opening remark, encouragement, and for this power pack words that you have given to us. We are very much happy as Unite, and also our partner Fast Track the Cure, who have supported us in this work. With this, I just want to go to our second segment, where the segment will be about the countries sharing the best practices, how national programs are advancing TB and DRTB literacy and advocacy. So we have a representative from three countries: South Africa, India, and Brazil. And I'm going to invite an amazing person whom I met first time in Brazil, and then I kept on meeting him in different various platforms and various occasions. He serves as a chief director for TB control and management under the National Department of Health in South Africa. Under his leadership, there has been a major increase in the number of TB tests conducted, a significant improvement in TB treatment coverage, a decline in the number of DRTB cases, and a remarkable improvement in proportion of patients successfully treated, particularly among the DRTB clients. He focused, resilient, and generally optimistic. He is a specialist family physician with interest in TB and HIV. He is currently the chairperson of Southern African Development Community and TB Committee. He received an honorary doctorate from UCT in recognition of his outstanding contribution to the fight against DRTB locally and globally. He has numerous peer-reviewed publications in various scientific journals. I request Dr. Professor Norbert to take on the stage and please share the best practices that has been done in your leadership in South Africa. Thank you.
Thank you so much for those kind words. I'm not sure. Let me start my presentation. I'll take you through the presentation, my slides. Are you able to see my slides? I hope so.
Yes, we can see your slide, but it's not in slide mode.
Oh, let me see.
Yeah, you just have to say that thing, slideshow. I think you need to say so.
Okay.
Just on the slideshow. Yeah.
Is it okay now?
Yeah, it's perfect.
All right, thank you. So the title is Mobilizing Youth Power for the TB Response sorry, let me quickly close this. Good. So in this presentation, I'll give you a brief overview in terms of TB situation in South Africa and provide a justification. Why do we involve youth in our TB response? Touch briefly on the challenges and then talk about the lessons that we've learned. But I'll use our TB and TB campaign as a case study. This is our situation. We high burden TB, high burden HIV, high burden DRTB. As you can see, our latest estimate shows the number there, almost 250,000 cases every year, and high mortality, 54,000 people die from TB in South Africa. Of course, we have one of the highest HIV co-infection, sitting at 54%. So our TB population made of individuals who generally, like half of them would have HIV, which means we'll be dealing with two conditions, and you can see catastrophic cost is quite bad, 56%, and 64% of our DRTB undergo catastrophic cost during TB treatment. Now, in terms of the youth engagement, we do this because youth are central to TB awareness, access, and adherence. So we really feel they are capable of shaping norms, language, and peer behavior. So the youth engagement enables faster uptake of testing and treatment literacy. So these are just some of the pictures of activities that the program has been conducting on the ground with our partners. So these are real activities. They're not pictures from the magazine. So as I present, I also give a short report in terms of what we were doing. Now, this is really aligned with our plan because acceleration of reduction of TB incidence and mortality are key issues for us, and we've developed the 4 pillars around communication, advocacy, finding, linking, treating, and retaining in care. This is our plan. And when you look at the messaging that we work with the youth on around awareness, because it's critical. They need to make sure people are aware and then create demand because there are a lot of dynamic norms in that area, reason to test. Stigma is a big problem with HIV, with TB in South Africa. So this has to be addressed. And the health-seeking behavior, we know that the youth, are not very much interested in spending a lot of time in clinics. So these are some of the challenges that we have. And we use them really to turn around, to make sure we work around that to solve the issues. Like you can see, these are various gatherings that our TV program been conducting out there to make sure the youth are involved, they know what is happening, and they help us then to educate other people. Some are taken care of by their grandparents, who also then get to be educated by them. So it is really a good dynamic. Now, in terms of our NTB campaign, we use a social behavior change communication approach. And as you can see, the messaging and everything really takes cognizance of the fact that what is good for an individual is not necessarily what you need for the family, for the community, for the policies and makers and all that. So the messages are going according to the context, but we work with youth to co-create those messages. So they're not just passive recipient, which is something positive. So other strategies include, for example, this is our toolkit, social behavior communication change toolkit, where we involve the youth. So you could have games and various other activities that we're conducting. There's a plan around that. Art competition is another area where we do. You can see this one. It's time to test and treat for TB. So as they play with art stuff, they also talk about TB and they remember something and they talk to their families as well. We also have various youth-centered target approaches to institutions of learning and those of higher learning. So these are the colleagues in the Northern Cape. They went to a university, talked to young people there, and then some of our Genesis partners joined this. It was a joint activity, a joint activation. So these are some of the activities that we do with the youth. Sometimes we talk to traditional health practitioners, but I will not talk much about that today. Today is about the youth. This is one of our ambassadors. This became one of our first young person learning in one of the institutions in South Africa. One of the very first who got the 6 months BPAL regimen when we introduced it in 2023. It was the end of the year. He felt so bad, and when we approached him to say we talking when we're celebrating World TB Day commemoration, do you mind talking to the people? He jumped in the plane from one of the towns in Eastern Cape, came to Johannesburg, spoke to people, and invited him again. So it's been really very good to work with such youth that know what they want, and they talk about their experience of getting a 6 month regimen for MDR TB, getting cured. They now again, the young again, they have ambition and feel that life has a new purpose. So I thought it was good to talk about it. We also have a My TB Story platform where people win when they give their stories. This has been an opportunity as well to allow youth to express themselves. Some of them won some awards. It was very, very good. It's a bit quiet now, but we'll soon revive it. This is a very good way of dealing with social media and access channel. Very, very important. The youth on Facebook, Instagram, and all that. At some point, we wasted a lot of money on national television, but then someone said, no, you can achieve more or even double by targeting youth on Facebook and all this, which the National Department of Health is now doing it for all other diseases in South Africa, but also allowing people of South Africa to see what's happening with testing has also helped a lot, because then you can look at your district, your province, and see whether the target allocated has been achieved. If you guys are not achieved, like here you can see achievement was 58%. So you don't really need to call a meeting to tell people that you're not achieving, pull up your socks. Maybe they never have those socks. So they can see themselves, and then they talk to their politician, local politician, they deal. So it's a good way of mobilizing people around. So in closing, I would like to say that we've learned a few lessons working with the youth. The first one really is that we should involving them in the design of the framework. It's been very, very good. Of course, you also invest in their training, mentorship, and all that. But for sustainability, what they've learned is critical, and we're very happy we involve them, because youth is not the future of TB response, it's the present. A lot of empowered youth strengthen awareness, access, and adherence in our program, which we find very useful. So that is all from me. Thank you so much.
Thank you so much, Dr. Norbert. Like, this is really very impressing for me, because this is what we think every time doing when we talk about engaging young people into the TB response. And I think South Africa has been advanced into this, because you all are doing already what we are suggesting people to do globally, especially my story campaign, social media engagement of schools and universities. Youth are present, you rightly said. And this work that we have done, like as a Unite also, we have done this work in some of the countries like India and Nigeria. And we are so happy that you have presented this officially on this global platform. And I'm sure people, those who are watching us, will be able to replicate this in their country. Thank you so much for this amazing presentation. Now, next, I would like to call upon Dr. Sanjay K. Mattu. Sir is a Joint Commissioner and Additional Deputy Director General at the Central TB Division in the National TB Elimination Program of India. He has 29 years experience as a senior public health professional, TB program manager, nodal officer of PPM, management of drug susceptible and drug resistant TB, pediatric TB, extrapulmonary TB, digital AI solution, TB and comorbidities, clinical research and public health research, operation research under the TB program, gender responsive approach and supply chain management. His work across all the sections of the TB, and in emergency medicines he has the experience of 10 years and has worked on an international health regulation for 6 years. I invite Dr. Mattu sir to kindly present your best practices from India. Thank you.
Thank you, Aman. Thank you for nice words, and thank you, the team, Unite team, to bring up this very pertinent topic for the discussion. And there was wonderful opening remarks by Dr. Lushika Jichu also. And we had a wonderful presentation from Dr. Nobert, having the South African experience. I'm having slide have been shared with your team. I will request if you can put the slide in the presentation mode, and then I will take through the what we are doing for India when we are considering the youth mobilization and advocacy program. So my presentation will be taking initial few slides will be taking the glimpse of where India is standing as per the TB burden is there and what exactly we are doing, and then for the youth mobilization and advocacy, literacy, IC activity, how India is going forward and delivering some activities. So some glimpse will be there of those ideas and activities which we are being delivered in India. Next slide, please. So, being the larger geography, we are having a contribution of tuberculosis. This is as per Global TB Report 2025. We understand that almost 25 to 30% of TB cases, the mortality, MDR TB incidence belongs to Indian contribution as per as far as the global load of these situations are seen. But we are doing good in the HIV TB incidence, where it is only 6% contribution over this HIV epidemic is in all over side in the declining phase. So because of this, we are in good position where HIV TB incidence is not on the higher side. If you want to see the progress of the indicator against as per our SDG targets are there, from 2025 we have 2015 we have reduction of 21% in the incidence rate, though we need to reach at the 40%. And then in mortality, if you want to see, we have reached from a 25%, which were at the baseline in 2015, to 21 per 1 lakh in 24. So you can understand that there is a 25% reduction and 21% reduction in the incidence and 25% reduction in the mortality. So it is a significant reduction, as if we are comparing with the global reduction. Incidence rate reduction is in better position when we are seeing global reduction of these rates. And if you want to see the success rate, it is also more than 90% as per 25 report. It was 53% in 2015. Can we have the next slide, please? And definitely our domestic budget, previous slide, please. So when we are having many countries in the world still they are depending more on the global funding, we have increased our domestic funding part, and more than 90% of our TB program budget is from the domestic fund. So this is another significant achievement from our side and commitment where government is committed towards elimination of the TB from the India. Next slide, please. So this is showing the progress over there, how the missing cases has been reduced. You can understand in the 2015 it was near about 1.5 million cases were missing, and now we are left only with near about only 100,000 cases in 2024, which are missing against the target. The blue light blue line is the global estimate as per estimate for India as per the global TB report, and this darker blue violet color line is achievement which we have achieved over the year. Next slide, please. So we are adopting the scientifically approved and the latest regimen which has been approved and globally being practiced for the DSTB, MDR-TB, pre-XDR, XDR, H monopoly. And in his presentation, Dr. Norbert was mentioning that how the BPLM is being given in the South Africa. In India, in 1 year, we have crossed almost 21 MDR-TB patient has been pushed on the BPLM, and accordingly, we are seeing the greater success rate is there. If you can see in DSTV also from 81% success rate, we have moved to the more than 90%. In H monopoly regimen also from 72%, it is near about 87% progress has been there in success rate. And if you want to see in the MDR TB, initially it was 50%, near about mortality was there. Now treatment success rate in MDR TB is also near about 75%. And similarly, pre-XDR cases, which are more difficult to treat, pre-XDR and XDR TB, we are having a significant good result and success rate in the these pre-XDR and XDR tuberculosis, which are nearing about the 70% in the pre-XDR, and in XDR TB also it is more than 50%, which is most difficult type of MDR TB. Next slide, please. So as it was mentioned earlier in the opening remarks and the earlier presentation, why this social mobilization and advocacy and IC activities are important. It is not only for the empowering the community, but for the service provider also. If you are having the right kind of IC material delivered to the community, not only it empower them to identify their early symptoms, then to seek the healthcare services, but they also provide supporting hand to the persons who are suffering from the tuberculosis. It is also a very strong tool for the stigma reduction. We understand that TB still is carrying a very high level of the stigma in the community, and if we are not empowering them with the proper knowledge, then the either TB patients are isolated and their suffering are not understood, And after this discrimination, patients are isolating themselves. They are not revealing their information, and they secretly may transmit the disease to other person also. So that is why this disseminating information to community level is very important. In India, we are having Ministry of Youth Affairs, and we are having My Bharat government portal is there, where we are having this education of the youth and developing their skills, their social mobilization and skill development, how they can not only empower themselves but can contribute to the community. So under that, we have engaged the Indian youth also. In India, 65% of Indian population is contributed by the youth, and they are very highly connected with the social media, community networks, university, youth groups. And in India, we are having multi-sectoral engagement with the program, where not only like using these social media and the main media, print media, or the video media, we are using their educational system also, where the communications and the right information is provided through the school educations, and the college level health education activities are being conducted. We are having innovations in communication, volunteerism, and grassroots mobilization. uh, Under the NTP youth engagement platform, what we are having the TB survivors, and these TB survivors, we are giving the trainings, and we are converting them to the TB champions, so that they can come forward. And because they are from the same community, when they are coming forward and they are giving the communications to the TB patients, it becomes more effective, and a community are more receptive, because they understand that these are the sufferers. And because of this, and in India, you can understand, we are every year new TB champions are being enrolled and engaged. And currently also we are having more than 50,000 active TB champions are there, who are going to the community and providing the community services and supporting many TB patients. Similarly, youth volunteers, we are having Niksha Mitra initiatives are there, under which the community is coming forward, and they can provide the some nutrition supplement also. They can provide the vocational support, and along with that, they can provide this moral social support also, where they can come forward and be a part and stand with the TB patient, and not to promote the this discriminatory activities. And they can forward and they can stand, yes, you are not having this very serious disease, and we want to give the support. So moral support. So Indian youth, we are not only requesting them for the nutritional support, but if they are not in position to provide the nutritional support, we are making them as a Niksha Mitra. The training are being done through this My Bharat Gov portal, and how they can come forward. And if they are not able to provide this nutritional support, how they can come forward and can provide this moral support. So this moral Niksha Mitra concept has been developed recently, and it is being utilized to provide this particular support. And we are having under this My Bharat government, we are having a national services scheme, and we are having a national credit code. Students are also there, which are there, and these are also being utilized for this Niksha Mitra and the social mobilization activities. Next slide, please. So here has been the commitment from our highest executive, and our Prime Minister is regularly having the supervision of the programmatic activity, how the TB program is delivering. And he is having a special recommendation that youth are to be involved at each level. We are using our elected representatives also, Panchayati Raj institutions, and every level of stakeholders in the country are part of our TB program, where we are doing multiple activities. Like recently our honorable health and family welfare minister had a meeting with the 10 high burden states, and the elected members, the member of parliament, were sensitized how they can carry these advocacy activities in their elected and geographical area, where their constituencies are there, how they can deliver. You can understand, we are using all kind of social media. It may be main media or social media, like it may be print media, it may be TV sports. We are having both channels are there. Not only that, we are using this radio medium also to have this dissemination and conveying the appropriate message. Then we understand that youth usually goes to the movies also, so we are having special weeks were made where these important messages were displayed before the movies were started in the cinema hall, and some important weeks were also taken, like pre-independence and after independence, and pre-Diwali and post-Diwali weeks were there, where the special these messages were displayed in the cinema halls. And our team is regularly having the monitoring of the daily activities of the IC, like how many print media messages are there, how many social media, it may be Instagram or the X or whatever media is there, how many posts are there. So daily review and monitoring is being done by the program also, to have the keywords, how these advocacy activities are being taken. Next slide, please. So another, as I mentioned, that in Jan Bhagidari, it is, we want to have every aspect of the community which can come forward. It may be elected members, like it may be elected members in the central government, it may be in the state government, it may be in some councils. So we are approaching them, and to have the advocacy activity. Then we are involving the youth also. We are having some other campaigns, like Swachh Bharat Abhiyan is there, which is being it is a campaign about the cleanliness, and we have integrated with this program, so that anti-spitting campaign are being done through this, so that air transmission of the tuberculosis may be prevented through this campaign. So we are leveraging on that. And as I mentioned earlier, we are having a Panchayati Raj institutions where we are using a different media, and we are giving the message how the treatment, adherence, and social support can push towards our TB elimination. Then we are having communication campaign focused on the cleanliness and TB preventions, which are being disseminated through a TV media and the radios also. And then we are having integration with other national programs, like we are having HIV program, where the messages are being integrated with the substance abuse, generating awareness about the TB. Stigma reduction is over one of the main campaign, and along with that we are having some IC activities which are towards the case identification, treatment, adherence, and then how we this youth can come forward and contribute towards the support to the TB patients in moral way. Those are there. And definitely we are having different occasions where we are having special fair and festivals are there, and special campaign, like be it a Republic Day, be it a Christmas Day, or be it a big Hindu festival or any festival. So we are not living any such activities where we are giving these advocacies are not being done. Like we are having every year the trade fair is there, international trade fair, and we are having a special booth is there for the TB messaging. Street plays are there. We are having a different kind of activities which we are doing at these activities. Next slide, please. So these are some of the display of the activity, some of the examples. If I would have taken, I would have taken almost 100 of slides if I would like to. These only some examples how we are doing. Like you can see some trade fair activities are there which are being held, and then youth activities are being depicted in this picture, where our program officers and representatives are there, and the communities are also involved in these activities. Next slide. So this was about some of the advocacy and rights activity which are being implemented in India, and how we are doing activity. So I hope I have communicated some of the new idea which may be replicated by other countries also. Thank you very much, and thank you for giving me the platform to make this presentation. Thank you.
Thank you so much, Dr. Mattu, sir. It was really amazing and very comprehensive, detailed information that you have provided to us. And I see there is a lot of space that where we can also come in as a unite, as a young people's network, to contribute and strengthen these initiatives that already India has been leading into. And I'm very much happy to engage with you after this call as well, and do something more than this. Thank you so much for the presentation and to be here.
Thank you, Aman.
So our next presentation is by Miss Meline Sane from Brazil NTP. She's a nurse, PhD in public health, technical consultant at National Tuberculosis Program in Brazil. I will kindly welcome her to present her presentation. She is here.
Okay, thank you, Aman. Can you help me with the presentation, please?
Yes.
Okay.
Louis, can you help me with the presentation? Louis here? Yeah.
Yes, perfect. Okay. Thank you very much for the invitation. Good morning, good afternoon, and good evening for everyone. Since we have an audience joined from many countries, right, around the world. So my name is Melisane Ferreira. I am a nurse and I work at the National Tuberculosis Program within the Brazilian Ministry of Health. And I would like again to congratulate the team organizing this event and sincerely thank you for the invitation to participate in this webinar. And today I will share some key learnings from Brazil on how we have been advancing youth mobilization in the TB response, especially through TB literacy and advocacy. Next slide, please. Okay, so from an epidemiological and social perspective, Brazil is considered a high TB burden country with profound social and health inequalities. This famous photograph illustrates this reality. Morumbi, an affluent neighborhood in São Paulo, located right next to Paraisópolis, one of the city's largest informal settlements. And this space, people coexist in the same geographic space, but with deep economic, social, and health disparities. And in 2024, more than 85,000 new TB cases were reported in Brazil. And the vulnerability to TB is shaped by gender, socioeconomic status, race, and ethnicity. In 2023, over 6,000 people died from TB, including a significant number of additional deaths among people living with HIV. And it is also important to highlight that Brazil accounts for 1/3 of all TB cases in the Americas. And the country is among the other countries with the highest burden of TB and TB HIV co-infection, although drug-resistant TB remains less frequent compared to other settings, with 1,047 people diagnosed with drug-resistant TB in 2024. Next slide. And so why is it important to talk about youth in the TB response in Brazil? TB in our country disproportionately affects young people and population in situations of social vulnerability, or people living with HIV, people deprived of liberty, indigenous people, people experiencing homelessness, and migrants account for approximately 25% of all TB cases in Brazil. In some states, in some Brazilian states, this proportion can reach up to 50%. And the TB profile in Brazil is predominantly young men with lower access to formal education, regardless of belonging to socially vulnerable groups. In addition, it's important to mention that the proportion of young Black people among TB notifications is higher than their proportion in the general population. This information suggests an increased risk of illness and reflects the impact of structural and institutional racism, which unfortunately remains present in our country. All of these highlights all of these highlights the importance of targeting TB policies and actions toward young people, not only as those affected, but also as key actors in the TB literacy and advocacy. Next slide, please. And beyond the programmatic actions developed by the NTP in Brazil, I really would like to highlight an important partnership with civil society, the Rede de Juventudes Afetadas pela Tuberculose, our REJAT, or in English, the Youth Affected by Tuberculosis Network in Brazil. REJAT is a national youth-led civil society network composed of adolescents and young people aged 12 to 30 affected by TB directly or indirectly. It promotes social inclusion, youth participation, stigma-free, and people-centered approaches, and strengthens community-based advocacy. REJAT also advocates for equity and for public policies that address the social determinants of health and, of course, of TB as a pathway towards social justice. The REJAT was officially launched in October 2024, and its creation reflects Brazil's commitment to strengthening the unified health system, our SUS, expanding social participation, and tackling the inequalities that drive TB transmission. As they say, nothing about young people affected by TB without them. Next slide, please. Okay, and here are some examples, just the previous photo. Okay, perfect. Here are some examples of REJAT's youth-led activities across Brazil, which have had a strong impact on TB literacy and advocacy. This first photo include participation in training on inclusive language in TB and HIV care, the creation of working groups. Next photo, please. The creation of working groups with movements supporting people experiencing homelessness. Next photo. Youth education sessions on basic TB concepts in different Brazilian states, for example, the states of Ceará, São Paulo, and Pará. And next photo, please. And the participation in international conference with the support of the Ministry of Health in Brazil, such as the Union World Conference last year in Copenhagen. Next slide. Youth engagement strengthens equity, innovation, and sustainability in the TB response. The Brazilian Ministry of Health and, of course, the National TB Program recognize young people as strategic actors and have included them in institutional events. For example, the National Seminar on Community Monitoring in TB Research, and the National Seminar on TB in People Deprived of Liberty, some examples of events, right? And also youth have also participated in dialogue and social participation space. For example, the meeting of the Parliamentary Front for the Fight Against TB at the Chamber of Deputies last year. And all of these reflects continuous partnership between government and civil society organizations. Next slide, please. In addition, during Brazil's National TB Awareness campaign in March last year, aligned with, of course, the World TB Day, young people affected by TB were placed at the center of the narrative. So the campaign featured real-life stories, accessible and no-stigmatized language, and a rights-based, people-centered approach. So our key lesson learning is that authentic youth voices increase the trust, reach, and impact. And of course, you can watch the full video through this QR code. Okay, next slide, please. So what's next for Brazil in strengthening TB literacy and youth leadership? The Brazilian NTP is advancing TB literacy through the Inclusive Language Guide for TB Care, co-developed with young people affected by TB, and I hope so, to be published later this year. And key lessons include that language can reinforce or challenge stigma, people-centered communication improves care, and health literacy starts with how we talk about TB. Next steps include also expanding partnership between government, civil society, and youth-led initiatives under the Brasil Saudável program. All these efforts align with the third phase of Brazil's national plan to end TB as a public health, which emphasize community engagement and social participation. Next slide. So I would like to thank again for the invitation and for the opportunity to share some experiences from Brazil, and especially to give visibility to civil society and youth leadership in the TB response. Thank you very much. Obrigada.
Thank you so much, Melisani. It was really very amazing presentation, and especially to see the government's initiative to strengthen the youth-led network and the civil society engagement. And I'm so much proud that RJET is our country partner as a global platform. They are the country chapter, and so much happy to see them flourishing and doing a lot of work with the NTPs in Brazil. And I look forward to see more work from NTP Brazil in collaboration with the civil society and youth-led networks in Brazil. Thank you so much for this amazing presentation.
Thank you, Amen. Thank you, everyone.
So now moving forward, we have an amazing panel discussion of young people. I would like to kind of introduce and bring forward Akshaya, who leads the Fast Track the Cure, a global community-led advocacy initiative supported by TB Alliance that aims to strengthen treatment literacy and promote timely, equitable access and uptake of TB and DRTB treatment. Akshaya, if you're here, please unmute yourself and take up your space.
Thank you.
Now
Thanks,
I'll
Aman. And we are exactly an hour into our webinar, and we have 30 minutes to go. So I'm just going to deep dive into this conversation because I know most of you have also been looking forward to what the youth has to say. And as Dr. Norbert beautifully put it in his presentation, youth are not future, they are the present. So before I dive into and introduce my amazing panelist, thanks to all the National TB Program colleagues and Dr. Luchika for really grounding us in what's moving at policy and program level, and for sharing some excellent examples of engaging youth and communities across the globe. And with that, let me introduce our panelists briefly. So joining us today are Aman Shukla. Aman, as you all know, is a dynamic youth advocate and public health leader with over 6 years of experience in both TB and HIV. Aman is the founder of YOUNITE Global and is a board member of the Stop TB Partnership's Key and Vulnerable Population Delegation. We also have Joy Jean Mangelia. He's a DRTB survivor, an MDR-TB survivor actually, and a dedicated TB advocate from the Philippines. Joy works with TB People Philippines and also leads the YOUNITE Philippines as acting president. We also have Mariana Taranto, and Mariana is project assistant at CDAPS, which is the Center for Health Promotion, a Brazilian civil society organization dedicated to health promotion and community empowerment across TB, HIV, and other priority health areas in Brazil and other countries. And last but not the least, we have Saurabh. Saurabh Rane is an XDR TB survivor and known to pretty much all of us, and he's one of the earliest patient advocates in the TB community. Saurabh believes in action-led advocacy, and despite suffering permanent lung damage due to his long treatment, he continues to run marathons and climb high altitudes, mountains to inspire patients and raise awareness around TB and life after TB. And I think that's what we all need, beating all the odds and rising up at the top. So Saurabh, welcome to the panel and making time for this in the wee early morning hours of where you are at. So jumping into it, I'm going to start the panel with my first question, Aman, to you. And I'll start the discussion with you because you have been engaged with this massive network of youth volunteers across the globe, which has, I think, about 10,000 youngsters already, doing some amazing work for a TB-led engagement. So, from your experience, Aman, what really changes young people, to move from just being participants of these networks to actual decision makers? And how does that shift really translate into trust and engagement with TB care? And you can, of course, bring your HIV work experience also over here. Just a small request to keep everyone's responses to 4 and 5 minutes so that we can make it on time, but free to chip in if you still feel you require more time. Please go ahead, Aman.
Yeah, thank you for this question, and I strongly resonate with it. I completely agree that young people are often invited into the TV spaces as beneficiaries or participants most of the time. Now things are changing. People are talking about the involvement of young people. Many times we are present in the room and clapping for others, but not seen as an equal partner in shaping decision. At the same time, I also want to be honest that it is not only a gap from one side. In some cases, young people have also not been given the opportunity or support to demonstrate impact. But we must ask, how can we impact, like how can impact be demonstrated if opportunity, space, skills, and most importantly, capacity building are given intentionally created for us, and leadership is not emerging in a vacuum. It is nurtured, so it takes time. Like an advocacy, it takes time. It takes, for young people also, you need to invest, and then you will have to see something in return. You cannot just do it today and then you expect tomorrow he will be, ending TB. No, you will have to give the space for them and build their capacity. From my experience, the shift truly happens when young people move from being consulted to being trusted. When young people are decision maker, several things change. First, trust increases, especially at the community level. Young people speak the language of their peer, understand real barriers to adherence, stigma, mental health, the most important thing that people don't talk, but it is there, and access, and are often the first point of connection of the people is navigating for TB care.
Yeah.
The second thing is engagement becomes more real and sustained when young people are involved into the decision making spaces. Programs are no longer designed for communities, but with them. Don't design program for me, but you should design the program with me, how I want, where I want, in what situation it will be, all those stuff. And here with this, I just want to also, in the introduction, you said I'm also the board member of the Stop TV Partnership, and I want to acknowledge the Stop TV Partnership because I know they are the first organization I know that brought the space for young people, because they didn't just speak about youth inclusion, but they acted on it by bringing a person on the board and created a space for lived experience to be shared directly. And Stop Tear Partnerships board meeting is really a very important and big board meeting where ministers, partners, donors, community leaders, and a powerful shift, happens there for the TB spaces. And that is how this movement led, of having a Unite Global. Of course, it was the support of TB People Global, and Timur, if he's there in this call, will know this better, the journey of bringing Unite Global. And our aim through Unite Global is very clear: to meaningfully include young people in the TB response, not as a symbolic participants, but as a leader.
Yeah.
When young people lead, TB care becomes more trusted, more accessible, more connected to real life, and that is the kind of shift we want to see in real life if we want to end TB by 2030. Thank you.
Excellent. Thank you so much, Aman. And really well spoken there in terms of we need to move beyond just symbolic or token participation, but actually make them the catalysts or put them in the forefront and have them drive the conversation. And I think that really brings up Joy into the conversation beautifully as well, because Joy, you were diagnosed, rather misdiagnosed, and with TB a few years back and had a difficult treatment journey. But you were one of the first people in Philippines to complete the shorter all-oral P-PALM regimen back in 2022. And after being cured, you've continued to use your voice to inspire hope and push for better treatment care and really empower your fellow survivors. So, what in your opinion, Joy, has been one way in which youth voices and lived experiences have helped reduce stigma or build treatment confidence and really help speed out some of the new and emerging newer regimens?
Okay, I've been working for almost 2 years. Yeah, two years in TB space as an active advocate of TB People Philippines and Unite Philippines. So I believe our youth are the future of healthcare. So you don't have to be a professional nurse or doctors or work in a hospital to be a caregiver. So I do believe that caregiving starts at home. I think our generation right now are very aggressive, aggressive and very proactive, or more aware in terms of advocating platforms that supports affected TB communities. The more help is available in the market, the more people feels the care and support that every community deserves. That's exactly what our young people are doing right now. So they're using their voices and their connections to show the world that there's community ready to help, inspire and support. So I am, as a survivor, I make sure my story or our story as a TB patient, as a TB survivor, is not only shared with people but also felt and heard with our leaders and with our governments, not only in the Philippines but globally. So that is why I'm here in front of you guys to share my voice, my story, and what I'm asking for. The diagnosis there and the numbers are continuously increasing, but the treatment regimens is still missing and inadequate, especially in the Philippines where corruption is very rampant right now. So sadly to say, but I'm still hoping, and I hope that the steps we are taking right now will continue to thrive and will not be the same step we took yesterday for us to end the cycle that we used to have. In the Philippines, tigilan na natin ang bulok na sistema, wakasan ang tuberculosis, or I might say in English, stop the dysfunctional system and the tuberculosis.
Thank you. Thanks, Joy. I mean, and thanks for bringing the country level perspective also. And I don't think that's limited only to the Philippines. It's definitely a global challenge. And I think that again brings me to Mariana, because Mariana is working with CDAPs, of course, but they also work in favelas in Rio de Janeiro and work with a demographic that is otherwise, if you would say, difficult to kind of do these kind of advocacy-based activities in. And therefore, Mariana, I would love to hear from you. CDAPS has been doing this for both TB and HIV space for years now. Could you share what community or youth-led approaches have proven most effective for CDAPs in building that trust with young people? Because I think that's one important flavor that needs to come in when you're working, especially in difficult settings. And as Joy put, this generation is very aggressive, so that also calls for having those agile activities that can actually bring in that difference. So, Mariana, over to you to share your thoughts and perspectives on how your experience has worked, especially in the context from Rio.
Yes, thank you, Akshay, for the question and the invitation. Very happy to be here with many people from different countries united to confront tuberculosis, and especially because what I prepare to say is very related, but is being pointed here. That is the importance of youth and community-based strategies. So how you already said, my name is Mariana. I'm part of CEDAPS, that is a Brazilian civil society organization that has been working for over 30 years now to promote health and straight community-based initiatives, especially in favelas and peripheral urban areas. And now I'm speaking from Rio de Janeiro. So to talk about tuberculosis in Brazil is essential to begin with the context. There's a really unique country that we are. how Melisani already told us a little bit. And despite some recent improvements, we remain among the most unequal countries in the world. And this inequality is directly reflected in the social determinants of health, such as housing, income, access to service, education, and exposure to violence, as others. So all of that to say that some certain populations are more vulnerable to tuberculosis than others, and of course, youth are not a homogeneous group. In 2004, for example, around 70% of young people diagnosed with tuberculosis in Brazil was Black. Many of them living in favelas and peripheral communities. So this is the context which we work. And we work with a social technology called shared construction of local solution that is focused on participatory diagnosis, planning, and evaluation. That means that the population is not seen as target, I was saying before, or merely as participant, but as author of the response to tuberculosis. And especially when we are talking about young people, that's really important. So you were asking about building trust. That depends a lot of recognizing youth as active subjects, capable of analyzing their own realities, proposing solution, and leading care process. So when young people, as me, I'm putting myself as a young people, see themselves as protagonists, trust, engagement, and adherence increase significantly. So in practice, this approach is related into several key strategies. One of them is the co-creation of action plans with young people based on the challenges and priorities they all identify in their territory. Another very powerful strategy is peer education. So young people talking to other young people using accessible language. So we are talking about treatment literacy grounded in a shared experience and mutual identification that is really important to translate scientific information into everyday knowledge. We also use conversation circles, workshops, educational games, and collective listening space. And in addition, there is a big effort to bridge youth, communities, and health servers, helping to reduce historical barriers to access the public health service here. And another key aspect is that all strategies are culturally adapted to the audience and the territory. So there is no single formula that I can pass. Actions always must reflect the local language, cultural expressions, and the interests of young people in each community. So now I'd like to share for a little bit a few concrete examples of strategies created by young people that we work. Let's see if I can share my presentation here now. Yeah, I think I can. Are you seeing what I'm showing?
Yeah.
Okay. So this is a strategy created by a young partner that we work based in an action plan that we created together. He did some meetings with other young people to talk about tuberculosis, treatment, symptoms, stigma, and change experience. And he did that based in dynamic. So he did a quiz asking how is the treatment made? And you had a lot of options. So it's a really dynamic way, playful way to talk with the youth. And in a favela called Vila Kennedy, here in Rio de Janeiro, we had a partner doing a TB graffiti to talk. And here is writing, tuberculosis has cure. And it's writing information, vacuum, SUS, there is our health system, universal health system, health prevention. So it's a way to bring art to talk about tuberculosis information. Here we have a really creative strategy that is called informational umbrella, that you hang a lot of notes with important informations about tuberculosis in an umbrella, and the young people, anybody that is passing, pick a number and read the information that is respected to that number. And and there you start a conversation about that information. It's a really good one because you don't need a lot of resource to do that. In the place that we work, in favelas, peripheries, a lot of time you don't have a lot of resources. So it's a simple and playful way to pass the information. We have also working with edu communication, that is developing the informational materials with the young people. So they are the author. That's the way we can guarantee there is relatable, simple language, and we can pen the information for young people. So they create the material with us.
Yeah.
And to end, of course, we are investing a lot with informational for social media. That is where a lot of our young people are spending their time today. So doing videos, reels, and cards, and other things. So that's a little bit of our strategy. And let me just stop the presentation now. I already stopped it. Okay, so to summarize all, the main lesson that this experience from Brazil can offer to other countries, I think, is that building trust with young people affected by tuberculosis requires moving away from top-down approach and recognizing the value of community knowledge. So if you are talking about building young people's confidence, we first have to demonstrate that we believe in their ability as well. We have to confidence there as well. That's it.
Excellent. Thank you so much, Mariana. And I think it's not a single formula, but rather a blend of what works and what does not, and having platforms like this which bring together solutions that have worked across diverse setting is one step towards it. But I'm going to pivot from our questions and come and put the center and the focus on Saurabh, because Saurabh, you've seen this TB landscape, especially around the youth engagement and advocacy, evolve in the past decade, and it's come a long way. But today there's a boom in really using of tech and social media solutions by youth, right? We have around 6 billion people using the internet in 2025, and a major chunk of this is youth between the ages of 15 to 24. And building on what you've heard today from all our previous speakers, as well as the NTPs and Dr. Luchika as well, I would like you to bring the focus on how tech can still fill that, that little gap that still remains, because despite all the work that has happened, that there still seems to be, that last mile that needs to be bridged so that young people affected by TB feel that they're connected, supported, and really able to cope with their treatments, not just while they're on treatment, but post-treatment as well. So the floor is yours. Love to hear your thoughts, Saurabh.
Sure. Thank you so much. I think, firstly, I want to agree with all the panelists on what they spoke. The youth is aggressive. The youth is energetic. We definitely need trust and we need a voice. So thanks for putting this together. What I can say about tech is tech can give you an opportunity to really amplify the work that you're doing. You no longer need 60,000 people doing all the things that they're doing. You can use a lot less people and do a lot more. In an age where YouTube knows which video I want to watch next, if we are not able to get information at fingertips real time to patients, especially young people who are using tech, then we really need to look ourselves in the mirror and ask, what are we doing? Because the world is progressing very, very quickly. So I would just say 3 things that tech can do very well for us. The first one is access to information. Just want to really batter that down. Let's get the information. Let's make sure it's correct, because a lot of large language models hallucinate even now. So we need to develop something that brings the right information from the right source in the right language that people want, in a way that reaches people. So you have bots, you have LLMs, everything that can work on text messages as well as their own softwares. If you make sure all the information is correctly fed into it, it could be 3 a.m. in a different country, and a patient that I'm helping doesn't need to be dependent on me to get the information, and I can respond when I want. But they have the power to get the information. Technology can really help us do one thing we haven't been able to do in all these years, which is create demand. We always go and pressurize everyone for supply. You now have an opportunity to create demand. You can empower people to ask questions, and nothing is stronger than that. So that would be the first point. The second one I would say is there are other solutions in other diseases which can be very, very helpful for TB. The reason why I say this is TB is not just a disease. It affects you physically, it affects you mentally, it affects your job, your life, your friends. There are apps that are FDA approved for mental health that are based either on chat, on video. There are diaries, there are actual steps that people have undertaken to be able to make a software or a device that is used by other people who suffer similar challenges. Let's not reinvent the wheel. Let's go out and let's see which challenges are pertinent to tuberculosis. Make a list of those. So if someone's on treatment, especially a young person who's very used to using their phones or the computer, you can go and tell them, hey, listen, people have used this. This works. Try this out. This is something I do with the patients that I work with. Especially given my time zone, I get very less time. I use technology a lot to help patients. If something worked for me, I just tell them to go ahead and do it. And if, of course, there is no medical prescription involved, that's the only thing. Do not prescribe anything that requires a doctor to look at it. But anything else, it's all game. It's all game. Anything you do to track your tasks, anything you do to make sure your mental health is better, anything you do to connect with other people, it's absolutely fabulous. So second would be just map out what's existing. Don't reinvent the wheel. There is a lot of tech out there sitting and waiting to be used. And third thing is a little different than the traditional route, which is build people's capacity. Builds people capacity to be able to go back to their own lives. A lot of patients that I have worked with, I've actually asked them to take online courses. You have 2 years of treatment. You can't work well in the next 2 years, become one of the best programmers that you can. You have a year and a half or 6 months, take that time to, I don't know, if you want to become a gym trainer, start working on that, like build capacity. Technology has given you that power now. I don't need a teacher. I don't need to go to university, buy them a YouTube premium subscription, your game. They can do everything they want. There is no better gift than giving someone their life back and the ability to make more money and provide for their family. It really empowers them. And this is what changes the game. And I'll give you one simple example. I started off by doing physically challenging activities because of my lung damage, because I believed that was the toughest thing that I would never be able to do. I never thought I would be able to go back to playing football. So I did it. Yesterday, one of the TB survivors that I have been working with for a long time, he never ran in his whole life. Last year, he ran 100 kilometers. Yesterday, he ran with 6 or 8 other survivors and made them run 5 kilometers. And it was life-changing for them. They don't believe they can even walk, breathe properly. And here you are running with someone who had the same issue. Technology has the power to reach out to those people and give them belief. So I would only urge everyone to do one thing. Think of tech as your friend. Think about all the ways you can use it. And think about how you can really empower the youth to become, as my peers said, more aggressive, more demanding, and we will solve the problem. With that, I'll stop.
Excellent. Thank you so much, Saurabh. I unfortunately don't have time for more questions, but I had one bonus question that I'd prepared for everyone. And what I would do is perhaps when we have our closing remarks going on, if all of you and including the audience members could just provide their comments and thoughts on this would be excellent. But what I really wanted to know was, social media, we've all spoken about it. The NTP head spoke about it, but today's young people have so many things competing for their attention, this has proved excellent for some of these other public health crises that we've seen in the past few years, be that the ALS Ice Bucket Challenge or COVID-19 also, which initially started with a lot of stigma and then over a period, because of the excellent, I would say, advocacy that was done around it, it no longer was stigmatized, right? So my question to the audience members as well as you, and feel free to, put your responses in the chat because that way all of us can read it, is really how can we tap into youth influence, especially among young people who may never have been directly affected by TB, to really create that authentic TB conversation, whether it's around awareness, treatment literacy, stigma, treatment, or even beyond treatment, post-life, post-treatment life. So would love to hear the thoughts from our audience also in the comment. And with that, and of course, the panelists, please feel free to put in your thoughts and feedback in the comments as well. But I would like to wrap up this session here. And thank you so much for making time from across time zones and speaking on this, in my opinion, one of the most important topics that we need to keep talking about even more in the coming years is how do we bring youth in the center and forward of TB conversations and as we move towards elimination. But yes, thank you so much. Over to you, Shivani, for the closing remarks. And once again, pleasure speaking with all you panelists.
Before we go to closing remark, can I just request everyone to turn on their camera and we can take a group picture, maybe?
Sure.
Yes. Okay. So many beautiful faces, known faces. Hello, Tauri. Hello, Sister Mary. Okay. So are we all ready? One, two, one more slide. We have 5 slides. So one, two, three. Okay. I'm good with these pictures. So now I will request Shivani to kind of deliver the closing remark. Shivani is a passionate TB youth advocate and an XDR TB survivor based in India. She's currently working in a corporate sector as a consultant, also serves as a steering committee member of Unite India, the country chapter of Unite Global. Over to you, Shivani.
Yeah, thanks, Aman. First of all, a big thank you to all the speakers, panelists, youth leaders, community leaders, and everyone who has joined us today. It is really like I'm really grateful, and it really shows your commitment, your love, and your honesty for this cause. So, thank you so much. Now, coming to today's conversation, it reminded us all one good thing or one powerful thing that tuberculosis is not only about medicines, it is about people. Like, it is about the stigma, the strength, the correct information, and the system which eventually supports or fails an individual through their TB journey. And as a brain TB survivor myself, I can vouch for this that TB treatment literacy is very, very critical. Like when I was sick, I was unaware of so many things. Okay, I don't know how the medicines will react on my body, how my body, what is going inside in my body, and whether am I going to survive or am I going to die. Like there are multiple things, questions, doubts, fear in my head at that time. So I truly believe that if the patient or the people who are taking care of that patient knows the disease, they understand the treatment, or they know how to manage the side effects, and they know when and where to seek support, it really gives them strength, confidence, and hope. So yeah, if that knowledge is missing, then fear and stigma can take over, and the results will be very bad or not nice. So, on that note, I also want to thank our co host, Fast Track the Cure, and TB Alliance for their continued support and believing in youth led initiatives and in young people. And we are looking forward to work with you again on a bigger level beyond this webinar so that we can create deeper impact and we can do much more good things in this space. And as we move forward, I urge everyone to take this dialogue beyond this webinar and spread the word. Um, the main three takeaways, which I can say, are strengthening TB treatment literacy at community level, inclusion of lived experiences uh, in any kind of decision which we are taking around tuberculosis, and making sure that any patient who is going through tuberculosis or who has gone through TB but they are still suffering from the stigma are not left alone. They are not unheard or unsupported. So yeah, TB, like ending TB is possible only if we all can, work together with courage, strength, and shared responsibility. So, yeah, thank you so much for joining this webinar and giving your thoughts, giving your time. It is lovely meeting you all, and let's keep this momentum going. Yeah, thank you. Take care. Over to you, Aman.
Yes, thank you so much. It was a cherry on the cake, I think, the closing remark. I really thank everyone. Thank you so much, Lochika, Dr. Norbert, Dr. Muttu, and Melissa, to kind of providing your support in this webinar. And of course, our peer leaders, Saurabh, Joy, Mariana, and especially our co-host, Fast Track the Cure and the TB Alliance, who supported us in this. I'm really very happy, and we will keep this continued. This is one webinar. We will be doing much more than this. Thank you, everyone. See you all
Thank
in
you.
the next webinar. Thank you.
Thank you, everyone.